So this is another video from influenza where we will going to talk about swine flu. So swine flu is caused by influenza A, mainly H1N1, H1N2, H3N2 subtypes. So Spanish flu in 1918, which is also caused by this influenza A H1N1 subtypes, which is an important outbreak, along with Hong Kong flu in 1968, which was caused by the influenza A H3N2 subtypes. So the transmission of swine influenza due to close contacts of pig, mainly close contact of nose and mucus during the raising process, transportation and meat packing. Symptoms include acute upper respiratory disease like tiredness, runny nose, anorexia, fever, weight loss, breathing problems. In severe cases, it can develop secondary bacterial infection and or viral infection. So they can develop fatal bronchopneumonia. Diagnosis: we can diagnose swine flu by observing the symptoms of the sample. Then samples are collected by observing the symptoms, and then the samples are sent for a laboratory testing, where the presence of the virus can be easily detected with the help of continuous cell line, which help us to isolate the virus. Then hemagglutinin inhibition test, neuraminidase inhibition test, reverse transcript test, polymerase chain reaction, that is RT-PCR, along with ELISA, that can be done. So for finding out swine influenza, viral antibody serological test is performed, such as agar-gel immunodiffusion test, indirect fluorescence antibody test, viral neutralization test, ELISA. Treatment: oseltamivir, paramivir, zonamivir, and that is usual, right? Because here we are talking about influenza A, so we will also use those type of inhibitors that have the ability to inhibit your neuraminidase tetramer, right? So that is the idea. You can also use your oseltamivir, Relenza and Tamiflu. You can also use amantadine and rimantadine. This amantadine and rimantadine are your M2 ion channel tetramer, right? So those kind of tetramers inhibitor can be used for this swine flu also.